What kind of dentistry really kind of floats your boat? What do you really like to do?
I guess I'll push the hot button nowadays, which is dental implants, which I teach at NYU. So I teach surgical placement and restoration of implants there because that's really one of my passions. A lot of people have that similar passion, but I really do enjoy that. But I also, of course, enjoy cosmetics, and I really just enjoy restorative dentistry as well.
Who have been some of your mentors in the in education in terms of dental implants? I always like to mention that for our listeners because there's some great resources out there where we can learn from. Who have been some of the mentors that have made the biggest difference for you in the world of dental implants?
Well, I'd be remiss if I didn't say Carl Misch, of course,
Yeah.
who we think of maybe as the father of implant dentistry. And when I was trained, although I did not go through the Misch, now Resnick continuum, although I did not take that, I was a Misch trained dentist. The program that I went through, which was several years, 3 years, I went through the program there. We basically used that Misch book as sort of our Bible, if you would, and we follow that very closely. So I'd have to say Carl Misch,
Yeah.
100%. Randy Resnick as well. There's so many other local folks that I really do appreciate, the knowledge that they imparted to me.
Yeah. Carl is certainly missed in our profession. And what an amazing, gifted educator and passion for all things related to dental implants, for sure.
Absolutely.
Where would you direct dentists that want to begin their journey in implant education? Where would you direct them today?
So that's a really great question. And there's a lot of good programs out there that provide sort of what I would call a basic or maybe a basic enhanced skill level. There's really good programs out there, whether it's the Resnick Institute now, or whether it's maybe Arun Garg has a few programs, implant seminars. There's a lot of those courses, but I really do firmly believe that you do need a university-based training to practice at the highest level. So while those courses are great, and I 100% endorse them, and I think you should follow that, I do think you would want to enhance that learning with an on-site educational experience. And there's many of those around. There's of course the AID continuums that are available at a number of places around the country. At
Right.
NYU, we have a program which is basically 2 years, which is hands-on. We provide the patients lecture, didactic, case presentations. It's really good. Loma Linda has something out there. There's a Maxi course, of course, and many local institutions have it. And so I do think some of these courses they can go and take weekend continuums really do provide you with a very firm educational experience. Would recommend to your listeners that they continue on with that to try to be the very best they can be.